It's a very challenging time. We're in the midst of a worldwide pandemic, forcing everyone to change the way they live their lives. Many have had to go into self-isolation, cut off from family members and friends. Some have not been able to work, whilst others have had to be redeployed to make the best use of their skills. It can be a struggle to process the non-stop images and stories of the outbreak around the world. The psychological support team for COVID-19 have definitely got their work cut out.
Everyone who is already demonstrating what we call some symptomatology, of anxiety, of stress, of isolation. These are very, very difficult circumstances, and just being isolated at home is going to impact on people's emotional health.
The 41818 number is already active for those in the community who need that extra bit of support during these uncertain times, particularly those who are vulnerable or living alone. Anyone feeling anxious or isolated will be transferred to counsellors who'll offer a 24-hour listening support service.
For the community, there's been a massive multi-agency support group established with key stakeholders from the care agency, head of children's services, the RGP, education, and mental health. And what we've done is that we've also established almost like, I like to call it an octopus system, whereby the frontline will be the 41818, and then depending on the specific need, those calls are going to be directed, for the different realms and the speciality of those realms. We have also, over the weekend, Sean Keating, who's a welfare officer and has also come on board as part of the psychological response team, has been training our frontline callers in active listening skills, those people who are going to be those who actually pick up the phone on the first instance and then direct those calls to, for example, the counsellors.
Unsurprisingly, the 41818 helpline has been very busy, and the psychological support team is keen to highlight that other support services in the community remain active too.
One of the things to remember is that if you're really, really anxious and you need to call, absolutely, right? That line is there and will be available for persons needing extra support. However, we are trying to prioritize that line, first of all, for our frontline staff, and we need to be very, very cautious of inundation. Things continue to be set up, and what I ask the public to remember is that lines, and organizations like GIBSAMS, like Childline remain completely operational and are also supporting the service. This is something that is completely unbelievable to most people, and the level of trauma being experienced, and what will come, needs to be very, very carefully managed for staff to remain resilient and to keep on.
It's undoubtedly frontline staff that will bear the brunt of this pandemic, and the Frontline Resilience Management Team is on hand to equip them with the tools to cope with the emotional effects of the COVID-19 outbreak for weeks and even months to come.